you see a participant list?
Yes, Bethany.
Hello, everyone. Good morning, good afternoon, good evening. Thank you so much for joining us today to hear about the training toolkit on simplified approaches for the detection and treatment of child wasting. First off, we just want to remind you that interpretation is available by using the globe button at the bottom of your screen. And we also want to give an advance thank you to our interpreters, Tim Levinson, Carmelo Velasquez, Jacob Salem, Amina Saif, and Nunu Nkum. The webinar will be recorded so that you can share the recording with your colleagues, and the process of recording has already started. So just a few pieces of housekeeping. Please keep your microphones and cameras off to save bandwidth. And if you have any questions during the presentation, please use the Q&A box, which is also at the bottom of your screen. We'll do our best to answer your questions in real time, and/or we'll also raise them during the Q&A time towards the end of the presentation. Oops. And just lastly, before we get started, we want to acknowledge our working group who've brought this toolkit together, and also our donors, which you can see here. This webinar is organized jointly with the Global Nutrition Cluster Technical Alliance, and so we thank them for their support as well. So at the end of the session today, we hope that you will walk away with an awareness of the training toolkit. We also want you to have a good understanding of the background of Chapter 1, which is focused solely on family MUAC. We want you to have an understanding of how to use the chapter. So we'll give you just kind of a very concrete layout of how to use the modules in the toolkit, how to access it online, etc. We will have a time for question and answer, both on the toolkit and anything you've heard today, or any other questions you may have. And then lastly, we will have a poll and a brief discussion time to just better understand some of your challenges and experiences implementing family MUAC, and also any other additional support needs that you may have. So I do have to apologize. I started this webinar without introducing myself. My name is Bethany Marin. I'm a senior nutrition advisor with the International Rescue Committee, and I will be assisting as a moderator today. You will also be hearing from Emily Keane, who's a senior nutrition advisor at Save the Children UK, from Pilar Charlequeller, who is a senior nutrition advisor at Action Against Hunger Spain, and also from Rathi Guhadasan, who is a senior learning specialist at the Humanitarian Leadership Academy. So we'll get started, and I will pass it over to my colleague Pilar.
Okay, thank you so much, Bethany. Hello, everyone. Thank you very much for being here. So I'm going to do a small presentation related to the simplified approaches before going directly to the training tool. So next slide, please. So just to have all of us the same understanding, when we talk about the simplified approaches, we are talking about a number of adaptations to the current community management of acute malnutrition protocol that they are implementing actually in different contexts and with different stakeholders. So the simplified approaches that we have are, as you can see there, the first one is the family MUAC, The second simplified approach is the community health worker-led treatment of wasting. The third one is the reduced frequency of follow-up visits. The fourth one is the MUAC use as a cell criteria diagnosis. The expand on admission criteria, also talking about MUAC. The use of just one product, therapeutic product, and how we modify this doses of product to treat the wasting. So normally the last fourth, we are using together at the same time in the field. Next slide, please. So if today we are talking about the simplified approaches, it's because during the last 7-8 years, there are many evidence or many results that we have shared regarding these simplified approaches. So today from the group, that what we can say or we can share with you is that if we use the simplified approaches, we can increase the number of children suffering from wasting that are identified and referred to receive treatment. We can see also that the use of these simplified protocols respect always the quality of care. So we have evidence that the treatment, the quality of treatment is the same that nurses have at health facility level with the CMAN protocol. And also, especially with the approach of the community health worker-led treatment, we can increase coverage of some treatment. So next slide, please. So from this group, what we are proposing or what we are working today here with all of you is when we can use all of these simplified approaches. Of course, we cannot say today that we can scale up all of these approaches in every places, because for this, of course, we have to wait for the WHO recommendations. But we are suggesting is that we can use some of them, one, two, or some of them under a special circumstance. So we need really, the first of all is to identify which are the challenges, which are the needs that we have in a context, to identify which is the simplified protocol that we can use. So I can give you an example. For example, if we have in our context the problem that the go to the health facility is really cost for the families that have to pay, or if we have other problems in an emergency context that, for example, we don't have the enough RUTF, or the nurses and health facility are really overburdened, we can choose one of these simplified approaches to try to reach more children suffering from wasting. All of this information is in the web of Simplified Approaches. So just for you to explain here this aspect, we need to identify the challenges and identify if it's possible or not to develop in the context. So next slide, please. We go directly to the Family MUAC, which is the training tool that we are going to share with you. And I have to say that is the most widespread simplified approach, actually. So when we talk about the Family MUAC, we want to refer to when training mothers, fathers, or other caregivers, we can identify more children suffering from wasting. So this is, of course, the objective of these simplified approaches. And as I have told you, is the one that many contexts are actually implementing in different realities. So next slide, please. And this is why we have decided to have these simplified approaches and to start with the training module. This approach has been tested some years ago in different contexts. So we have evidence in Niger, we have also evidence in Kenya, as you can see there, with the peer review. And with what we have evidence, mostly this peer review were trained mothers. And the result has said that mothers can identify and refer children in the same and with the same quality of care that other members can do it. So they can do it the same as actually community volunteers are doing or community health workers are doing. So this is why we can say that it's a really approach that can help us to reach more children suffering from wasting. Together with this peer review, we have other reviews who has, with this review, we have taken into consideration some case studies, some research implementation that again allow us to say that this is a very efficacy way to reach more children. So with this evidence, we are going to start directly to talk about the training tool. Just to repeat it, that all of this information related to Family MUAC, you can have it in the Simplified Approach web. So next slide, and over to you, Emily. Thank you.
Great, thank you, Pilar. Hello everyone. I'm going to give a brief overview of how the training toolkit was developed. And the first thing to say is that the intent of the toolkit was to build on the body of good practice, training materials and resources that already exist on the simplified approaches, rather than starting completely from new. Next slide, please, Bethany. So the first part of the process was to conduct a desk review of existing training tools and resources relating to the simplified approaches, and to conduct a learning needs analysis. The objective of this phase of the work was to map the resources that already exist that could be built upon in the training toolkit, to identify the areas of technical discrepancy and/or gaps in existing materials, to review and identify ways to structure the training toolkit, and lastly, to identify what works when it comes to training on the simplified approaches. Next slide, please. So from the desk review and the learning needs analysis phase, we identified a number of recommendations which influence how the training toolkit was developed. These include the importance of context, which affects which simplified approaches are implemented and in what combination and how. The way we responded to this in the training toolkit design was in each chapter to make specific protocol and implementation choices based on what we understood to be the most likely use cases in terms of the most likely trainers, service providers, training audiences, and protocols. However, we also ensured that there are lots of options for adaptation of the materials according to context. Secondly, the training manual needs to reflect and respond to this diversity in implementation contexts, and needs to be flexible, but also easy to use and navigate. The way we responded to this in the training toolkit design was to arrange the chapters around the who, the trainer and training audience, and the what, the simplified approach. Lastly, again, reflecting the diversity of implementation context, we recognise that technical protocol and programme design decisions need to be made that will affect who is trained, on what, and how. We also recognise that these decisions would not always be made by the trainers themselves. So in the training toolkit, in addition to the training materials themselves, we've added an orientation section at the start of each chapter for programme decision makers. This section is also relevant and useful background for the trainers. Next slide, please. So next, I'll give a brief overview of the process of developing the training toolkit. So as previously mentioned, the contents build on existing materials where they were available. Once the chapters were developed, they were shared and technically reviewed by the Global Simplified Approaches Working Group. And throughout the toolkit, we also incorporated adult learning best practices, which Ravi will explain to you more later. We also wanted to highlight a couple of limitations with the toolkit. So while the toolkit is based on resources and tools that have been used by implementers, the final harmonised global training package has not been implemented with users. So there may be more refinements to make based on implementation experiences. Secondly, as previously mentioned, the simplified approaches are a rapidly evolving field where there's a lot of ongoing learning. The toolkit was based on the latest evidence at the time it was developed, but it's recognised that it may be helpful to update and adapt different elements of the toolkit in the future. For example, as new evidence and guidance emerges, for example, the upcoming updated WHO guidance on the prevention and treatment of wasting. Next slide, please. So just to finish off, This is to give you an overview of the chapters that are contained in the training toolkit. So the first chapter focuses on family MUAC, which we'll be delving into more detail in today. The second is the community health worker-led treatment of wasting. The third, the reduced frequency of follow-up visits. And the fourth, the simplified treatment protocol. And I'm going to hand to Ravi now, who'll take us through the contents of the toolkit.
Okay, thank you, Emily. So if we go to the next slide, please. So each of the chapters has an introduction, which is aimed at programme decision makers, and the two modules. So the introduction here covers much of what Pilar and Emily have just presented. So it gives you an overview of the evidence to family MUAC and some guidance for implementation, including monitoring and integration of family MUAC into health promotion activities. It also gives some guidance on how to use the chapter and its limitations. Next slide, please. So module 1 is set up to support a training of trainers workshop for health workers. So that would be a one-day workshop, but it could also be adapted for on-the-job training. And its purpose is to prepare health workers to be able to train caregivers in family MUAC through a workshop, but again could also be adapted to deliver this training in individual consultations. And the module covers what family MUAC is and why it's important, and goes through how to measure MUAC correctly and check for edema in the feet and how to teach this, and also how to counsel caregivers on what to do if the MUAC is red or yellow on their child, including specifically where to go and why, potential consequences of not seeking help, and what they might expect when they arrive at a referral centre. It also addresses issues around counselling and supporting caregivers who are not measuring MUAC at home after they've been trained. And then we have some assessment tools. So for module 1, that is a pre and post test MCQ and a standardised skills test. Next slide, please. Each of the modules has an introductory section providing guidance for both programme leads and trainers, and it's very, very useful to read this before you go to train. Some of the information contained include the learning objectives and the topic broken down into sub-modules by time, activity and equipment required, and recommended criteria for participants and trainers, and details key concepts and skills required to deliver the training. There's also some recommendations on group size and venue, and some additional resources that I will show you when we do a demonstration at the end. Next slide, please. So this is an example of one of the resources in the introductory guidance. So you can see that the module's broken down into sub-module with the time requirement for each and equipment, and it gives you examples of some of the different types of participatory learning activities we've tried to include. And also signposts you to how you can capture informally formative learning and progress throughout the activities, as well as having a summative assessment at the end. Next slide, please. And to aid preparation, we've also provided an equipment checklist and other resource and information to help you prepare. Next slide, please. So just to make the point that this is a global toolkit, so it will need local contextualization. So it's always advisable to review the content thoroughly in its entirety before you embark on any training, and adapt it for context. And that could include adapting content. So for example, making sure that nutritional recommendations speak to local diet and practice, and also adapting training in terms of your local resources and logistical considerations. Next slide, please. So the bulk of the modules contain these session plans. Many of you will be familiar with this format of session plan. So essentially the page is divided into 3 columns. At the start of each activity, the suggested time allocation will be given on the left-hand column at the top. This is a snapshot from the middle of a particular session plan. So the middle column will detail each activity in a stepwise fashion, and it will also give you the information that you need to deliver at each stage. And then on the right-hand column, you'll have some additional information and also facilitation tips and guidance to guide you through the activity. So this is aimed at including trainers with lower levels of training experience. And there's plenty of space around the session plans for trainers to make their individual notes. Next slide, please. So module 2 is designed to support delivery of a workshop for caregivers. So it's set up as a 2-hour workshop, but it can be adapted, as I mentioned, for training caregivers on a one-to-one basis during clinical consultations, as well as integrating it into another health promotion activity. And the topics covered include explaining what a family MUAC is, going through how to measure MUAC using the MUAC tape with some practice, and how to check edema again with practice, and what to do once you have the results. Next slide, please. So just to show you whereabouts, how you can find the toolkit and how to navigate your way through it. If we go to the next slide, please. So we'll share the link with you, and the toolkit is hosted on the Kaya platform. So once you click on the link, you just need to press the green button. And if you go to the next slide, please. And then you simply need to log in using your password or organizational sign-on. If you've not used Kaya before, you will have to create an account, but there are instructions to do that on the left-hand side, and it's free and takes you a couple of minutes. Next slide, please. And next slide, please. Thanks. So at this point, if I can share my screen. So hopefully you can all see my screen. So once you log on, the first thing you will see is this orange link at the top. And if you click on that, that will essentially take you to a downloadable PDF for the entire toolkit. So it is rather large because it includes all of the session plans and the training resources. But for example, if it's difficult to read online, you can download it to your computer and read it offline, or if you want to have it available as a printed manual in your facility. However, recognizing that not all chapters will be relevant in all contexts or and can be used independently, we've also presented the toolkit as an introduction and separate chapters. So and each of those consists of a series of downloadable PDF resources. So the first introduction is an introduction to the entire toolkit, so the background to simplified approaches and some of what Pilar has explained this lunchtime. And then there are a couple of pages on abbreviations and a glossary of terms, which is relevant to all of the chapters. And then if we open up the chapter we're discussing today, which is Family MUAC, the first thing you'll see is a short description of the chapter. And then we have the introduction and the 2 modules, as I've previously described, as downloadable PDFs. Or if you choose to read them online, there's also they're hyperlinked within to help you navigate them more easily. And then we have 3 additional resources sections, the first of which is a recommended resources section. So this is really aimed at trainers to help familiarise yourself with the material. So we have a list of all the resources, which is also available in the module, as well as downloadable PDFs. web links that you could link to, including a video that you could link to and watch. The second additional resources section contains some training resources. So that can include a visual aid. So if you open that up, you can see some pictorial aids that you could print off and stick on the wall when you're training, or hand out to participants to help you. And then we have things like case study cards. So the details of the case studies with the answers are given in the appropriate part of the session plan. However, these are printable case study cards that you can print and cut up and then take to the training and hand out to the groups at the start of the activity. And then coming back to the training resources section for module 1, which is the training of trainers workshop for the health workers, we also have a participant manual. So that's a short document containing some key concepts and pieces of information, some space for participants to make their own notes, and some additional pictorial representations and references to aid memory and act as a reference after the workshop. And then the final additional resources section is the course assessment and monitoring section. So for example, for module 1, which is the training of trainers workshop, we've given you a suggested pre-test MCQ, post-test MCQ with some suggested questions, and a standardized skills test score sheet, so that can help you administer and mark the skills test in a standardized way for testing MUAC measurement and edema checking. So that's basically an overview of chapter 1, and all the other chapters will be laid out in a similar way. Before I end, I just want to just show you this feedback section, which is right at the end of the toolkit after chapter 4. We are very interested and actively welcome your feedback as we continue to develop and improve the toolkit. The first way to share your feedback or ask questions is using this link to the Simplified Approaches working group here. Or you can use the Kaya feedback function, which is monitored. So you can click on the feedback form link and then click on this answer the questions link here. And there's some simple questions that you can click on, but I just want to draw your attention to this free text box at the end. So you're welcome to feedback or ask questions as you prefer. So thank you very much for listening. Before I end, I'd just like to thank my colleague Kaylee Smith, who is our digital learning specialist, who designed the Kaya page and the beautiful PDFs for this toolkit. And then happy to answer any questions on the toolkit, and I'd like to hand back to Bethany.
Thank you, Rathi. Apologies, can you all see my screen?
Yes.
Yes. Yes.
Great. Thank you to Rathi, Pilar, and Emily for your presentations on the toolkit. So right now we wanted to give all of the participants an opportunity to ask any questions. I know some of you have been posting them in the Q&A box throughout the presentation, which is great. And that's where we can get started. If there are other questions, please do continue to use the box and we'll address them in real time or maybe even live here. And then lastly, as a reminder, we can send anything that was not addressed or we don't get to during the presentation, we will answer and send back out with some additional information that you all have been asking for, such as just the very link to this toolkit. So a really good question came through from a participant asking or really reflecting on the fact that the most challenging part of family MUAC may actually be advocacy and familiarizing duty bearers, government, and other stakeholders about the approach. Is there an advocacy note included in this toolkit? Perhaps we can ask, perhaps Emily, you can address this question.
Yeah, thank you. It's a really great question. So just to mention a couple of the resources that are available in the introduction section. So we do have an overview of the approach, the objectives, and also the evidence base for the approach, and also a number of different implementation considerations as well. So it's a bit of a brief overview of some of the common barriers and challenges, but also some of the evidence for the approach. So I think depending on the kind of policy barrier that you're facing, they might be some useful tools that you could refer to. Also, in addition to that, on the Simplified Approaches websites, there are a number of evidence briefs as well, and a number of resources for policymakers. So that's another good place to look if you're looking for some more kind of tips on kind of technical advocacy. But I think later as well, we'll be talking about some of the barriers to implementation. So it would be great to kind of hear more if there are any kind of specific challenges that are being faced.
Thank you, Emily. And it's really helpful to know about the additional resources. Another question that came through was just asking, or again, reflecting on the fact that MUAC may not be as sensitive to and as sensitive of an anthropometric measure, and may potentially miss MAM children. And so I was just wondering, Pilar, if you could comment on this, either from the perspective of there being an additional intervention that's referenced, or your thoughts.
Okay, yes. Yeah, thanks, Bethany. Yes, yeah, this is a good question. This is a good point, no? Because we always know we always have this discussion in mind, no, regarding the MUAC and the weight for high and everything. So the point here with this approach is what we are really talking about is how to screen children that are suffering wasting. No, it's not to treat children. No, it's not the criteria admission that we have explained today here with the family one. It's more how to increase the children that need to be identified in the community. So what we have evidence, as this is what we have developed the tool, is because actually, no, in most of the countries or in most of the CMAM policies, the way is that normally there are community volunteers in the community that every month or once every 3 months do the screening at the community level. And what we have seen here is that mostly mothers, and of course also the fathers that we have been training, they can also identify these children. So what we are really looking for is not to substitute the way that we are doing screening. So we know that actually the screening, maybe there are some children missing because of that, what you have said, that we are not including, no, with MUAC, maybe white for hair is less than 2. But what we want to do with this is to increase the places are the children that can be identified before that waiting maybe for 1 month or 2 months, in the community, waiting for the community volunteers to arrive and to identify the children. So this is really the focus, no, of the family MUAC, not try to substitute, but more that. After, for the point that you are saying, if we are missing or not other children, I think that maybe, in the next webinar with the other simplified approaches, we can maybe discuss longer that. But for today, it was just as I tell you, the screening, and actually the screening, the MUAC is the tool that is normally used with the different CMAM protocols. Thank you.
Thank you, Pilar. That's really helpful. We've received several questions about the module that is dedicated towards caretakers. And Rathi, perhaps Emily, because I know Emily, you gave some background on why certain audiences were selected to develop the training modules. Can you give some information on whether this means necessarily that, you know, we're seeing a shift of screening from healthcare workers just to caretakers, and or if other members of the community can be trained to administer family MUAC?
I can maybe talk to the second part of the question because that's probably simpler. The module that's aimed at training caregivers could easily be used to train community health workers as well, and potentially the training of trainers workshop, depending on your community health workers, the training of trainers workshop could potentially be adapted as well to be used for community health workers. And I'll let Emily speak to the first part of the question.
Yeah, and I'm not entirely sure if I can do justice to it. So if there are other people on the panel who have got answers, please also add. But so I think what we know in terms of the evidence as Pilar presented, I think it does seem as though family MUAC is the kind of most commonly implemented simplified approach. I'm not sure if we have the information on how it relates to other forms of kind of detection and screening, and whether it's replacing or kind of adding. But I think, yeah, I think what we do know is it's the one that's kind of growing most rapidly. But also there are lots of different ways that the approach can be implemented, different kind of targeting approaches, using different existing kind of mechanisms and systems within communities and health systems. So while it's kind of called one approach, there are lots of different like implementation choices and ways that it can be adapted for different contexts. But I don't know if anyone else has got anything more on that.
Yeah, maybe I can share something, and at the same time I can answer also some questions that I have read in the QA. That what we are presented here is related to what you have already said, that it has to be adapted to the context. No, for example, what I can say, no, in some countries, it's depending how the community at the end is organized or not. No, because here we are talking about the trainers of this, the trainers of training. And for example, in some specific contexts, they are using already some groups that are working in the community. Maybe they are working, there are a group of mothers that they are already working or discussing or talking about different senses of sensibilization, sorry, or good practice, no, hygienic good practice and everything. So we can use this group also to train them and identify their children in the community, no? So at the end, and I think it was one of the first questions that I have answered, directly in the chat, that of course this is the base that we have, and maybe it's interesting in each of the country see, which is going to be the best way of implementing, because there are many experiences, and also well, today we don't have time, but in the Simplified Approach web, there is not only the peer review, but also some case study that it could be also useful, that you can, yes, maybe, to check on, have a look at it, could be useful for that to adapt.
Thank you, Pilar, Emily, and Rathi for those points. I'm going to suggest that we actually move on from the Q&A, but I would like to just quickly address some of the questions that I'm seeing in the chat as well, which is Some are straightforward about translation. So we do intend to translate the toolkit currently through the Kaya website. It's only available in English, but our intention is to translate it first into French and next into additional languages. So your feedback here is really helpful. And these questions about the specific languages that you're interested in, we will definitely take it into account. I also see a lot of technical and implementation questions, and I just wanted to repeat what Emily shared. So there are additional resources on simplifiedapproaches.org that can provide some more background on the programming. And also there are some 2-pagers, some evidence notes. I see some questions about the evidence. So please do visit that website and know that we do update it regularly with content based on feedback that we receive. So feel free to share with us your needs. Then lastly, yes, we'll share, just to say again, in a follow-up email, we'll address your remaining questions and definitely share all the links that we've mentioned today. So thank you everyone so much for your engagement. So lastly, just before we close our time together, which has gone by really quickly, we wanted to just do a poll and see what kind of discussion points that may generate. Although again, I see you've raised a lot of really good questions and ideas. We're going to use Menti. For anyone that hasn't used it before, you can either just open up a separate web browser and type in menti.com and it will ask you for this code. Or if you're attending and you have your smartphone by your side, you can use this QR code. So I'll give everyone just a moment to log in. And then there's just a few questions that we'll use as prompts. And I'm just going to share my screen.
Bethany, I don't think we can hear you, I'm afraid.
I'm so sorry. I'm glad we've been moving along anyway. So now knowing where people are coming from and the experience that you have with Family MUAC in your context, would be great to know kind of what role you have primarily served or will serve in the implementation of Family MUAC. A lot of program coordinators, managers, officers, advisors. Just a few TOTs and trainers, but hopefully with this resource, this is something that we can all be trainers or support training anyway. Some health workers and a lone MOH policymaker. Apologies. I saw the comment, it just disappeared, so we might have to address it at the end of the call. One thing we would like to know, and this is kind of a short answer form, is what makes you optimistic about the potential of Family MUAC in your context? And this question, I think will help it will be helpful to hear from one another essentially what is working well with regard to Family MUAC, and what is really acting as a booster in your context. But yeah, overall interest and willingness to implement, empowers families, it's accessible and sustainable. Simple and effective, absolutely. Help to identify wasting as early as possible. This is certainly one of the objectives of the approach, and so good to see that here as well. High interest, potential for scale. Great, this is really encouraging. Thank you, everyone. With so many people on the line, yeah, this is a great way to get a quick snapshot of your thoughts. Next, so on the other hand, what is, in a few words, what would be the biggest barrier to bringing Family MUAC to scale in your context, or from your perspective, of course? And thank you for the comments on the side as well. Government commitment, institutional sustainability, still accessibility. So on the one hand, Family MUAC, we're optimistic that it is accessible, but it's also a barrier, of course. Resources, policies, and regulations. One question that I did see in the Q&A that we didn't get the opportunity to address was this question back to there being currently a lack of global guidelines or guidance rather on Family MUAC, and then what would be the process or the kind of the steps to implement, to collect data and or develop evidence on the approach. And I'll just say that that's something that we also do have information on the Simplified Approaches website. CHW reluctance. We've seen this before. And then if there's anything I know we put a lot of information at you today, but if there's anything that quickly came to mind that you feel like will be useful, or the first thing rather that came to mind that you think will be useful about the Global Toolkit on Family MUAC. The approach itself, the design. Okay. Really glad to see some of this feedback. And as Rathi mentioned, and Rathi and Emily, I believe, we haven't field tested the toolkit yet necessarily while it's based on pre-existing materials. We haven't used it in the field, so we really rely on and kind of really request your feedback as you use it in your programs. And then last but not least, I saw some of these comments come through in the Q&A and also potentially in the chat. What other tools, resources, and guidance might be helpful to bring Family MUAC to scale in your context? I really like seeing the changes with people's input. This one takes a moment because you have to go through all 6 to rank them. Implementation and monitoring guidance. This was another question I saw that came up in the Q&A, so I'm glad to see that it's coming up here again. It was a question about monitoring, a question about understanding when it might be a good time to do refresher trainings, and how do we know that our implementation has been impactful. And so from my perspective, this is high on my list as well as things I'd like to see developed for implementers in the future. For those of you that commented other, if you want to, in this chat, just type in what else you had in mind. It would be really useful for us to know that. And or multimedia digital tools, if there's anything specific, or if if you want to add any specificity to your rankings, please feel free to add a comment. So thank you so much for your involvement there. I know with so many people, it's difficult to have something engaging, but this was really informative, and I hope for you seeing other, where people are coming from and some of the things that are making them optimistic and the barriers that they're facing. Yeah, hope it was useful for you. So I'm just going to give some last notes before we end the call today. Just a moment left here. So as I shared in the beginning of the presentation, we're really lucky to have the support of the Global Nutrition Cluster Technical Alliance on this presentation. As you may or may not know, the GNCTA provides all types of support, or can provide all type of support in addition to helping host webinars. So if you are looking for support for nutrition in emergencies, you can visit their website and you can click request support and fill in a form for the type of support you're looking for. This may include remote in-country or technical support, looking for consultants, looking for quick technical advice even. So there's a help desk function if you're not aware, and peer support. And this is what the website looks like. And this is what the request form would look like as well. Lastly, we just want to thank you so much for your time today. We thank our presenters and our interpreters. Before you leave, at the end of this Zoom call, you'll see a brief evaluation that will pop up. Please do fill it in if you get the chance. It will help us prepare better or differently for webinars in the future. And as a reminder, those future webinars will include community health worker led treatment, or ICCM plus, some of you may know it as, simplified combined treatment protocol, and reduced frequency of follow-up visits. So thank you again so much, and enjoy the rest of your day and the rest of your week. And please keep your eyes open for an email and additional correspondence from us on the really good questions that you've posed in the chat that we weren't able to get to today.